Well, we now know, Cynthia, that the total number of Toronto cases is 280, and that's why Toronto's emergency medical doctor of health has come forward, Dr. Eileen de Villa, with a message again to make sure that people are staying at home and they're practicing the physical distancing. The reason this time is because the problem of community spreading is now a serious one.
We know that we do have community spread, as I've indicated on a number of occasions thus far. So what we're estimating now when we look at our numbers, and of course they're constantly changing, the last I heard from the team was that roughly it was about 10% of cases that we're finding that we are attributing to community spread at this stage of the game.
Now that the rules on who's allowed to do what are a little tighter, the city is ramping up efforts to enforce them. Toronto Public Health inspection officers, along with municipal licensing and standards, are being told that tickets can be issued for anywhere between $700 and $1,000 to non-essential businesses that remain open, depending on the nature of the offense.
When they are out and about and in the course of their audit duties, in the event that they encounter circumstances where a business that has deemed to be non-essential by the province, if they encounter a circumstance where they are not complying with the order, there will be enforcement action taken.
Among the new cases in Toronto, there are 2 individuals that have tested positive for COVID-19 in the shelter system. According to Public Health, the second has no connection to the first case reported last week. There are new facilities to create physical distancing for the homeless, including one for those waiting for test results. Both of these people are recovering in isolation.
We've had 2 positive cases at 2 different physical locations and in 2 different types of programs. So one was a respite program and one was a regular shelter program. Both of those people are currently at our isolation site and receiving medically supported care. We've developed a very comprehensive 3-tiered approach. We're focusing on prevention, mitigation, and then recovery. We've rapidly implemented this plan over the last week, and we are taking significant steps because we do know that this is a very vulnerable population.
On another note, almost 33,000 community housing tenants will be getting some form of rent relief as a result of the pandemic. The city has said that rent will be adjusted or deferred for all residents, 90% paying a monthly amount based on how much money they earn. Mayor John Tory, meanwhile, is also calling on social and affordable housing providers to be flexible at this time.